Here we go. So welcome to exercise, the principles of exercise therapy, and this is why exercise. This is where we tell you about why you should be exercising and what's that got to do with physiotherapy. So jumped ahead there. So exercise is involved in the treatment of all physiotherapy interventions. So no matter what we're doing, exercise is very much part of that. And we want to help. We want to help you to become a champion of exercise. What does that mean? It means that you become an exercise addict, advocate, and you'll be prescribing exercise. So there's going to be different ways that we're teaching you on this course. There will be some lectures, some will be recorded, some will be live like this. We're live at the moment. Some practicals, online stuff, and then your own exercise routine. So this course is about you being the first patient and you treating yourself with exercise. If you already exercise, okay, and you're already all over this, give me a thumbs up in the chat box, please. Thumbs up if you're already an avid exerciser. Yeah, lots of people. Okay, so I'm preaching to the converted here. Well done, the part-time first year. Brilliant stuff already. So what we're going to do is we're going to learn how to prescribe exercise. Now, exercise is a drug. It needs a correct dosage. So when we give that exercise, it is just the right amount, not too little and not too much. And we understand that this is going to be ruled via principles, okay? And we've got various PET principles that will underpin everything that we do. And we've got to understand that exercise is involved in all aspects of physiotherapy treatment. So what do we need to learn? We're going to learn the structure and the function of the cardiorespiratory, the neurological, and the musculoskeletal systems. We're going to describe how long exercise adaptations take through training. And we're going to learn to prescribe, plan, implement, and evaluate exercise as a treatment modality, which sounds wonderful to me. Hopefully you too. We're also going to demonstrate good communication skills and instruct people safely. We do this via explaining what we're going to do, then we're going to demonstrate it, and then we're going to get the patient to imitate it. We're going to think about health and safety and some contraindications. And we're also going to be thinking about healthy lifestyle, healthy choices, physical activity. So this is semester one. We've got this, why exercise, and that's exercise driving a system of systems. Then we've got the components of fitness. Then we've got functional movement, functional strength and conditioning, balance and proprioception, biomechanics, needs analysis, range of movement, exercise communication and feedback, exercise prescription, exercise rehabilitation planning. And we do that all in the first semester. Okay, that's hard work. That's not easy. That's your first semester. Okay, second semester, muscle physiology, exercise outcome measures and screening, the cardiorespiratory system, the neuroendocrine system, designing group exercise, Viva practice, and I'll come on to that in a moment. That's your exam practice, cardiac rehabilitation, and hydro and aquatic therapy. Okay, so that is a packed year. It's what we call a long, thin module. Okay, so you get to see me almost once a week for the next academic year. Thumbs up in the chat box if that sounds like a plan, sounds like you're excited about that. Yeah, and with good reason. It's going to be a lot of fun, this course. Okay, so moving on, the CSP, the Chartered Society of Physiotherapy, and the Healthcare Professions Council, okay, say that we need a number of skills. So anatomy and physiology, you're getting that all in AMP1. Okay, exercise prescription and planning, you're getting that in PET. So AMP1 is really about kind of the assessment and that manual therapy, and PET is more about the exercise treatment side of things. So what do we expect? Obviously, when you're in, we want you to sign the register. That will be important. I'll be taking a register of what's going on here and how many people are logged in. We want you to wear sports clothes. A lot of the practical stuff will require you to be physically active. So if you've got an injury, just email, let me know. Okay, you don't have to say that in front of the group. Ask questions if you need to. If you're struggling with the concepts, just ask. Okay, I don't like mobile phones in the session, but we will be using your mobile phone right at the end when we do something called Kahoot, which is a bit of a quiz. okay? And we would encourage you strongly, okay, to take the stairs and not the lift, okay? And the reason being, around the university, you might not have seen this, okay? But we'd encourage you to be a role model, okay? So taking the stairs, okay, not the lift. Physio's on the 7th floor in Allerton, so we walk up the stairs every day. The physio team got this down, super healthy. Okay, right. So what is physiotherapy about? So physiotherapy is a profession concerned with human anatomy and physiology, human movement and function, maximizing wellness and potential and minimizing disease and injury, ultimately solving real world problems. And my God, have we got some at the moment, okay, that we need to solve. There's never been a better time to be a physio, and definitely the world needs it. And the reason why is that the fourth leading cause of preventable death in the world is physical inactivity. Okay, so the top are high blood pressure, tobacco use, and high blood glucose, and then fifth is obesity. And we can tackle all of these by just doing more activity, okay, because we're not doing enough. So I'll give you an example. So Kuwait is the least active country in the world, and Uganda is the most active country in the world. Okay. So just type in the chat why you think that might be the reason. Okay. So why is Uganda so active? Okay. And Kuwait so inactive? Give me some reasons in the chat, please. What are your thoughts? Okay, so it's the weather. Yeah, might be too hot to go outside. Transport. Yeah, definitely, Isaac. Okay. Transport. Resources. Uganda is very rural, so you're going to have to travel. Okay. Technology, says Neil. Okay. Lifestyle and access. Transport. Manual labor. I think you're talking about manual labor in Uganda. Finances, says Mark. Job types. Technology, says Natalie. Okay, so these are all good reasons for it. So in Uganda, okay, because transport's harder to come by, it's more rural. People are more physically active, doing normal jobs that require physical activity. In Kuwait, culturally, okay, because it's very hot outside, nobody would walk anywhere. They would drive places because it would be culturally unacceptable for people to walk. So culture has a lot to do with this. Okay, so there's lots of things that we want to think about with regard to that. That's the task we've just done. Okay, so moving on. Real world problems are public health problems. It's a global health problem at the moment. Okay, but there are other problems that are going on at the same time. Coronary heart disease, cancer, cirrhosis of the liver, COPD, diabetes, depression, dementia, stroke, hypertension, kidney disease. Now we're dealing with all of these, and all of these can be helped with physical activity and getting the body moving. So exercise is going to affect the whole body, effectively a system of systems. Okay, the mind says I need to move. That's going to stimulate the neuromuscular system, which will stimulate the metabolism of the muscle. Heart and lungs will get involved, pump the blood round. Neuroendocrine system gets involved. The immune system gets involved. And we've got some hormonal changes that happen with exercise. Okay, so it's a whole body thing. It's not just about the muscles. So physical activity, okay, is going to make it harder for us to breathe deeply. Okay, our skin also, okay, needs to sweat. It's very healthy if it does that. Our muscles are made to move. Okay, and our joints like the compression, particularly weight bearing. Our heart needs to pump, and we need to get out of breath in order to maintain that physical fitness. Okay, and also if we're not doing regular exercise, you can become constipated. Our bones require impact. Okay, otherwise we can get things like osteoporosis. Okay, and all your organs basically are made better by exercise through this system of systems. Okay, so that's why it's important. So it's driving that system of systems, as I've said. Okay, we've also got to think about exercise in terms of the psychological effects. Improved self-esteem, self-image. You're going to have things like increased amounts of energy. You're going to have stress relief. Okay, we're going to be able to control our weight a little bit better. You know, energy input must be equal energy output. So when you see this thing, just exercise, do not just think it's all about muscles or it's all about the heart and the lungs. It is whole body health, very holistic. Okay, so the definition of exercise therapy is using voluntary muscle activity produced by the integration of higher centers, cardiovascular, pulmonary, neuromuscular components to rehabilitate these systems. Okay, and that's Stuart Porter's book, okay, Tidy's Physio, chapter 13. Okay, give me a thumbs up in the chat box if you've got a copy of Tidy's already. Who's got a copy of Tidy's? Yeah, Amy has, Ashton has, Claire has, Phil has. Just 4 of you? Any more? Okay, seems not. Okay, well worth getting, Tidy's Physiotherapy. So we've got to understand that exercise is a subset of physical activity. So physical activity is this broad thing where basically when you're doing any type of bodily movement, okay, whether you're cleaning the house, whether you're, going for a run, whether you're doing the any type of bodily activity, that's physical activity. So a good example of that would be walking the dog. Okay, you're just being physically active. Now, exercise is a subset of physical activity, and exercise is very different. So we're going to also cover sport. Sport is when we do anything competitively. Okay, it has to be a game environment. Okay, when we're competing. So exercise can become a sport, but we're going to focus on exercise rather than physical activity or sport, although they're interrelated. Okay, just give me a thumbs up in the chat box if that makes sense. We understand the difference between sport, exercise, and physical activity. Yeah? Good. Okay, so everyone's fairly happy with that. So we've got a little acronym that we use to remember this. And exercise is about reps. Okay, and the way we remember that is exercise is a subset of physical activity that is repetitive, it's planned, it's purposeful, and it's structured. Okay, so we have to repeat the movement. Okay, we have to practice the movement. We have to make sure that there's something going on. There's a reason why we're doing it. That's the purpose. We're going to plan it. So there's an early, mid, and late or periodization. It's got to be structured as well. We can't just do stuff willy-nilly. There's got to be some thought behind it. And that is why we're prescribing exercise. So there are 3 types of exercise. We're going to focus on the first type, the therapeutic and rehabilitative exercise as well. Now, there's also exercise, people just going to the gym and keeping fit. And then there's the competitive side of exercise. This is what might be strongman, might be CrossFit, might be powerlifting, might be Olympic lifting, where people are kind of exercising, but it's sport because it's competitive. So there are different classifications of exercise. So you could be prescribing exercise in primary prevention, stopping people from becoming obese or becoming inactive. So encouraging activity out in the community. And then we could be working with diseases, okay, particularly chronic diseases, people that want to exercise, but they need some help with that. I'll be working in musculoskeletal outpatients department or in private practice. We could be in occupational medicine, in the workplace, introducing things like standing desks or walking meetings. We could be in education like I am, or we could be in research like I also am. Okay, and research about which exercise is best for what activity. So exercise is a huge area. It's not just this tiny little thing that we do. There's lots of different versions of that. Okay, we've got to think about exercise in 4 different areas. Okay, because 6 out of 10 people in the UK are not getting enough exercise. That's unacceptable. So we need, 1 million deaths per year, okay, are preventable if we were to do more physical activity. Okay, so we've got to think about what's going on in the home, what's going on at school or the university, what's going on at work, and what's going on in the community. So what I want you to do is just think a little bit now about how we could change things in the community. In fact, what I might do, what I might dare to do, is put you into some breakout rooms. Okay, give me 2 seconds. Okay, so I'm going to put you into breakout rooms now.